40 million American women deal with bladder leaking. They buy special underwear. They cross their legs when they sneeze. They avoid jumping with their grandchildren. They skip the exercise class because they are afraid of what might happen. And fewer than 1 in 5 have ever told their doctor, because somewhere along the way someone told them this is just what happens when you get older. It is not. Stress urinary incontinence is a medical condition. It has a name. It has a cause. And in 80% of cases, it can be significantly improved without surgery and without medication. But nobody will fix what nobody talks about. I'm Dr. Rosalind Keller, 36 years in family medicine. I don't sell supplements. I don't run a clinic anymore. I'm here because someone should tell you what your doctor doesn't have time to. You are in the grocery store. You run into an old friend. She says something funny and you laugh hard. And then you feel it. A warm trickle. Not much, but enough. You clench. You shift your weight. You cut the laugh short. You say goodbye quickly and walk to the bathroom to check the damage. This has happened before. When you sneeze, when you cough during a cold, when you lift something heavy, when you bend down to pick up the dog's bowl. Every time you feel that small betrayal from your own body. You started wearing a thin pad every day just in case. You have a stash of them in your purse, in your car, in the guest bathroom. You manage it, but you never talk about it, because talking about it means admitting it is real. I spent 36 years watching women suffer in silence with this condition. The myth that causes the most damage is that leaking is a normal part of aging. It is not normal. It is common. Common and normal are two different things. Cavities are common. They are not normal. They are a fixable problem. Leaking when you laugh, sneeze, cough, or lift is called stress urinary incontinence. The word stress does not mean emotional stress. It means physical stress on the bladder, the sudden pressure from a laugh or a sneeze, and it is almost always caused by weakness in the pelvic floor muscles, not by a broken bladder. Here is how your pelvic floor actually works. Your pelvic floor is a group of muscles that stretches across the bottom of your pelvis like a hammock. This hammock holds up your bladder, your uterus, and your rectum. When this hammock is strong, it keeps everything in place and keeps the urethra, the tube from your bladder, tightly closed. When you laugh, the sudden pressure pushes down on your bladder. A strong pelvic floor absorbs that pressure and keeps the urethra shut. When the pelvic floor is weak, it cannot absorb the pressure. The urethra opens slightly and urine leaks out. Think of it like a garden hose. A strong hand on the nozzle keeps the water in, even when someone turns up the pressure. A weak hand lets it spray. After childbirth, menopause, and years of gravity, that hand has gotten weaker. The connective tissues have thinned. The muscles have lost tone. But muscles can be rebuilt at any age, including these muscles. Before we go further, I need you to hear this. If you have any of the following, stop and call your doctor before changing anything I described today. Kidney disease of any stage, liver disease or cirrhosis, diabetes treated with insulin. You take blood thinners like Eliquis or warfarin. You take a diuretic. You take a proton pump inhibitor like omeprazole. You have uncontrolled high blood pressure. This video is education. It is not personal medical advice. Nothing replaces a doctor who knows your chart. Now, with that said, here is what the research shows. I want to tell you about Marlene. Marlene was 72 years old, retired dental hygienist from Tampa, Florida. Marlene had been leaking for 11 years. It started after menopause. At first, it was tiny amounts, only when she sneezed hard. She mentioned it once to her doctor at a checkup. The doctor said it was normal for her age and told her to do Kegels. Marlene tried Kegels for 2 weeks. She was not sure she was doing them right. She stopped. Over the next decade, the leaking got worse. It happened when she laughed, when she walked uphill, when she picked up her granddaughter. Marlene stopped going to her water aerobics class. She stopped wearing light-colored pants. She spent over $100 a month on incontinence pads. She never told her daughter. She never told her friends. She assumed this was her life now. When Marlene finally came to see me, she was embarrassed to the point of tears. I told her what I am telling you. This is not your fault. This is not permanent, and we are going to fix it. Here is your first self-assessment. The next time you cough, sneeze, or laugh, notice whether you leak at all. Even a tiny drop counts. Then answer these questions honestly. Does it happen more than once a week? Do you wear a pad or liner every day just in case? Have you stopped doing any activity because of leaking? Have you changed what you wear because of it? If you answered yes to 2 or more of these, you have stress urinary incontinence that deserves treatment. This is not something you should just manage around. This is something that can get better. Here is your second test, the pelvic floor squeeze test. Sit comfortably in a chair. Imagine you are trying to stop the flow of urine midstream. Squeeze those muscles. Hold for 5 seconds. Release. Could you feel a clear lift and squeeze? Could you hold it for the full 5 seconds without your belly, thighs, or buttocks tightening? If you could not feel anything at all, or if the squeeze felt very weak and you could not hold it beyond 2 seconds, your pelvic floor is significantly weakened. If you felt a clear squeeze and held 5 seconds, your pelvic floor has some strength, but likely needs more endurance training to handle sudden pressure from coughs and sneezes. Things that make leaking worse. First, chronic constipation. Straining on the toilet puts enormous downward pressure on your pelvic floor. Over years, this stretches and weakens the muscles. If you strain more than twice a week, treating the constipation is step 1 before pelvic floor training will work. Second, high-impact exercise without pelvic floor preparation. Running, jumping, and heavy lifting can worsen leaking if your pelvic floor is already weak. This does not mean you should stop exercising. It means you should build pelvic floor strength first. Third, caffeine. Coffee and tea are bladder irritants. They increase urgency and frequency, which puts more stress on a weakened pelvic floor. Reducing caffeine to 1 cup per day often reduces leaking episodes noticeably. Fourth, chronic coughing. If you have a chronic cough from allergies, asthma, or a medication like an ACE inhibitor, every cough strains your pelvic floor. Treating the cough is as important as treating the leak. Here is what strengthens your pelvic floor. First, proper Kegels done correctly. Most women who say Kegels did not work were doing them wrong. The correct technique. Squeeze only the muscles you would use to stop urine flow. Do not tighten your belly, thighs, or buttocks. Hold for 5 seconds. Release for 5 seconds. Do 10 repetitions. 3 times per day, every day. Improvement takes 6 to 8 weeks of consistent daily practice. Second, the knack. This is a technique where you deliberately squeeze your pelvic floor 1 second before you cough, sneeze, or lift. Pre-bracing the muscles prevents the leak. This single skill eliminates leaking in up to 70% of mild cases. Third, magnesium-rich foods. Almonds, dark chocolate, spinach, and pumpkin seeds support muscle function throughout your body, including the pelvic floor. Fourth, adequate water intake. Paradoxically, drinking less water makes leaking worse because concentrated urine irritates the bladder. Drink 6 to 8 glasses of water spread throughout the day. This is the Keller pelvic floor protocol. Step 1. Do 10 Kegel squeezes 3 times per day every day. Morning, afternoon, and evening. Set a phone alarm if you need a reminder. Hold each squeeze for 5 seconds. This takes less than 2 minutes per session. Step 2. Learn the knack. Before every cough, sneeze, or lift, squeeze your pelvic floor first. Practice this deliberately for 2 weeks until it becomes automatic. Step 3. Reduce caffeine to 1 cup per day and treat any chronic constipation or cough that may be undermining your progress. After 8 weeks of consistent practice, most women see significant improvement. If you do not, ask your doctor for a referral to a pelvic floor physical therapist. These specialists exist, and they can assess your specific weakness pattern. Marlene followed this protocol for 10 weeks. She did her Kegels 3 times a day without missing a single day. She learned the knack and practiced it every time she felt a sneeze coming. She cut her coffee from 4 cups to 1. At her 10-week follow-up, her leaking episodes had dropped from daily to twice a week. By 16 weeks, she was down to occasional minor leaking only with hard sneezing. She went back to water aerobics. She wore white pants for the first time in 8 years. She stopped buying incontinence pads. She told me that 2 minutes of exercises 3 times a day gave her back a part of her life she had given up on. Write your age below. And tell me, how long have you been dealing with this in silence? You are not alone. I read every comment. Here are your 5 takeaways. 1. Leaking when you laugh or sneeze is not normal aging. It is a treatable condition. 2. 80% of cases improve with proper pelvic floor exercises. 3. Kegels work, but only if done correctly and consistently for 6 to 8 weeks. 4. Learn the knack. Squeeze before you cough, sneeze, or lift. 5. Reduce caffeine, treat constipation, and see a pelvic floor therapist if exercises alone are not enough. This is the conversation your appointment never had time for. The question you wrote down and then crossed out in the waiting room. I don't sell anything. I don't have a practice. I profit from you not needing me. You deserve answers without embarrassment. I'll see you in the next one.